Good afternoon, and thanks for joining us to learn more about accessibility in healthcare. One of the first questions that we often get when we start talking about accessibility is why? Why should we be investing in an accessible website, and why is this important for our organization? Well, for starters, it's the right thing to do. Now, many hospitals and healthcare organizations have a mission statement that's usually centered around providing exceptional care for their communities. Well, in order to provide that exceptional care, not only does your physical building need to be easily accessible, but also your website, forms, documents, and really any other things that your patient may need. So having an accessible website is really just part of the overall way that you deliver on your mission. Another reason accessibility is really important is because it's about real people who need healthcare. And we're not talking small numbers here. Roughly 20% of the population has a disability of one form or another. The estimated resident population of the United States in December of 2018 was around 328 million people. So using 20% as our base, that means roughly 65 million US residents have a disability. Now let's combine that with the fact that disabilities increase as we age, and the number of US adults ages 65 and older is expected to grow to almost 90 million by 2050. This means that we're likely to have a greater portion of the population that has disabilities. Also looking forward, those adults who've used digital technology almost all of their lives will expect to continue to do so as they age. So this is only going to become more important. People with disabilities often need additional health care. And according to the Center of Disease Control and Prevention, in 2006, disability-associated healthcare expenditures totaled nearly $4 billion. Now that's a large chunk of money. We also know that a website is often the first touch point a patient has with your organization. So if your website does not provide a good experience, your users are likely to leave and take their business elsewhere. There's also another benefit to accessibility, and that's usability. A key thing to understand is that when we design with accessibility in mind, we actually improve the experience for everyone. And a great example of this is closed captioning. So closed captioning is really necessary for those with hearing loss, but it's also really convenient when you're in a place with multiple TVs playing at the same time, or simply in a place where you need to be quiet. Now, if you still need more of a reason for your organization to buy into accessibility, perhaps the added benefit of search engine optimization will sway you. So just like a screen reader or other assistive technologies, web crawlers read code. So using the proper HTML markup and tying things together programmatically not only makes your website accessible, it also increases SEO. Adding transcripts for all those videos helps search engines index those videos, but it also helps those users who are deafblind or people who would just rather read than watch a video. And if people at your organization are still not on board, you can gently remind them that it's the law. Now, Kevin's going to go more into depth in some of this in a little bit, but depending on the type of organization that you are and where you receive funding, there's numerous laws that could apply. But probably the most notable law for healthcare is Section 1557 of the Affordable Care Act. And that's because this law really removed any fuzziness that there may have been with healthcare websites and whether they needed to comply. Section 1557 requires that healthcare organizations take steps to ensure that communication with people with disabilities are as effective as those without disabilities. So if you're attending this webinar, the answer is yes. Yes, your website does need to be accessible, and it's very, very important because it's the law. Over 2,250 lawsuits were filed in the US federal courts in 2018 alone. So the lawsuits are targeting these big corporations like banks and healthcare businesses, along with government agencies and some others. But some of the more recent healthcare complaints over the past several years were against WellPoint, HCA Holdings, Tenet Healthcare, CAC, Florida Medical Centers, Epic, and CVS Pharmacies. Now, while a lot of these lawsuits are settling outside of court, and others, the plaintiffs are actually winning. The courts are ruling that the cost to make your website compliant is not an undue burden. So, when you're asked why you should invest in accessibility, the answer is it's the right thing to do. There's a significant portion of the population that have a disability. People with disabilities often need additional health care. Accessibility creates a better user experience for everyone. It enhances search engine optimization efforts. And of course, it's the law. So now that you know why you should be thinking about accessibility, Kevin will share some benefits of how to use the Site Improve tool to get started.
Thanks, Amanda. There are a couple things that we probably want to talk about. First and foremost, hopefully some of you folks are already Site Improve users and you're familiar with some of the concepts and some of the tool aspects that we're going to talk about today, but we're going to approach it as you're not really familiar with us. So one of the things I want to do is give you a little bit of an introduction to who we are as a company. So on the next slide, you'll see, next slide, thanks. What would you say you do here? And as a company, Site Improve really is a software company, but we're also a solutions company. And what does that mean? It means that we are providing the resources to support the use of the software and really try to make it a successful launch for you. If you're using our products, we have additional services that we can provide that enhance what you're doing. So it's really about getting the most value out of the tools that we provide. That's partially what my role is to help our customers understand, sometimes from a fairly high level, of what we're wanting to accomplish, because we're really looking at a cultural shift here. So if you look at some of the things that we do, according to this list, we have, of course, our automated accessibility tools that we'll talk about. But we want to provide guidance and recommendations on how to fix those issues. Now, some of that comes in the tool itself. Some of that comes with our supporting staff. Okay, we want to help you categorize and get an idea of where to start. So this isn't just about providing you with a whole bunch of information, but helping you dissect that information and figure out what you want to do with it. Okay, we have a very usable platform. We want to give you those highlights of those problems right on the page, so it's putting it in context for you, as well as code-based. So what we're doing is we're giving you the most direct line in to take a look at what those issues may be. We want to monitor progress. We want to show you when you're making headway. We want to show you that you're reaching compliance goals that the company has set, and the tool has got a great set of monitoring functionality as well. Not only that, but one of the other services that we do provide are the manual testing services. Now that gets into the areas that go beyond what automated testing tools can do. So we do have a staff here that is happy to enhance what those automated checks are by doing the manual checks that go along with them. We can talk about that in a little bit more depth when we get into it, but again, it's really full service by providing all the value that we can out of the tool. Now, Site Improve itself is regularly monitoring almost 50 million web pages, and that's on a regular schedule, whether it's weekly, every 5 days, whatever the case may be. So as you can see from the numbers on the slide here, we are a global company. We have over 7,200 customers globally across 29 countries, representing 40 plus nationalities. Now, as a company, we've grown considerably since I've been with the company. There were approximately 60 people globally when I started. We're at over 550 now. So it's an amazing, amazing company doing some really cool stuff in a really cool industry. You'll see that the satisfaction is fairly high based off of what we're talking about here, 94%. That's a pretty good retention with our customer base. Once they get the tool, they want to keep using it. Again, almost 50 million pages checked. And we have close to 70,000 active users in the tool that are basically managing their own sets of pages all the time. So pretty large solution, pretty unlimited capabilities of what we're able to assist with out there. Next, we're just going to kind of address some general facts. Amanda's already kind of talked about some of these numbers already, but we'll go into a little bit more depth. And some of this falls right back into website activity and digital accessibility / usability. So, for example, statistics show that 88% of visitors are less likely to return to a website after they've had a poor experience. Well, what defines that poor experience? It could be any number of things. It could be not accessible. It could be misspellings. It could be broken links. There's a whole range of different issues that can affect your website and give your users that poor experience. Another number that's very high on that scale, 91% of visitors do not trust a website that contains errors or mistakes. This is especially true in healthcare. Your reputation is right out there online in front of your customers, and if they can detect mistakes in content on a website, that really lowers their trust in what you're doing on the medical side of things as well. Okay, so 60% of clicks go to the top 3 websites and search engine results. Now, why is this important? Because you'll see that a strong crossover with search engine optimization and accessibility exists. The things that you do for SEO improve accessibility. The things that you do for accessibility improve SEO. So by focusing on accessible website development, you're also increasing your chances of being one of those top 3 websites in those search engine results. Once again, 1 in 5 people have some form of disability. Now, again, we're talking about ranges or types of disabilities. Not everybody relies on a screen reader in that 1 in 5 population. Some may just need eyeglasses or be able to zoom the text a little bit. There's a large number of males, 1 in 12, have some form of color blindness, which falls into that spectrum as well. And there's even, with an aging population, there's a lot of us that probably don't even identify as being that 1 in 5. As a person with a disability, we may consider it an inconvenience right now, but that doesn't mean it won't progress to the point where it's a disability in the future. Back to the other numbers, 75% of people base their perception of that brand on a digital presence. So that's sometimes the first exposure to what could be a national medical brand. It may be a specialty that they're looking at, or whatever the case may be, but those first impressions are very strong. Finally, there's been a large increase in those lawsuits in 2016, and that number continues to go up. 2019 is going to be a record year for the number of complaints filed against all types of businesses, including healthcare. So onto the platform. This is just a quick screenshot of what our dashboard may look like to give you some indication. It's very user-friendly, very readable, very intuitive. So we're very proud and extremely happy with the feedback we get on the interface alone. We're built on a core platform, which has an entire suite of different tools. Now, we're focusing on accessibility today, but as you get familiar with Site Improve, you'll notice that accessibility consists of quality assurance. It consists of monitoring things for brand loyalty and other aspects that way. We've got a lot of different integrations with the tools that you're currently using, so we can bring this information already into your working environment. We can also really give you an extensive level of reporting on what's going on that activity, whether it's setting that baseline, that starting point, or whether that's generating quarterly reports to leadership to show them the progress that you're making. The tool has all of those capabilities built right in. So who's using Site Improve? You'll see some familiar names, not just in healthcare, but across pretty much every industry. Essentially, if you have a website, we can be of value to you. The larger the industry and the larger the presence, the more efficient we can be as well with providing that depth of information that's needed to manage some of those sometimes millions of pages. So what does it mean to be accessible? We have already touched on that a little bit, or Amanda did earlier. So essentially some of the things that I'm going to do is just go into depth a little bit more, build on some of the concepts that she's already talked about. So Probably the biggest thing that we see and that we run into as far as accessibility goes is that websites are not accessible because the owners are unaware and uneducated. Now, we need to change that. What we're not saying is we can't assume that poor developers are setting out to make poor quality sites. We know that's not the case. We have very talented people writing very extremely complex code, but what's happening is there's little bits and pieces that are being left behind that end up affecting some of our users. So accessibility has been that missing piece, but now it's more at the forefront with some of the compliance activities and definitely as part of the conversation now. So it needs to be part of that development cycle from day one. And that means, as we'll talk about in a moment or two, there's a lot of folks that need to be involved and have this understanding of accessibility and how it affects your business. Okay. One example that we like to talk about is the fact that accessibility needs to be part of your development from day one. The example that I've seen used, and I think actually is pretty clever and makes sense, is blueberry muffins, for example, or chocolate chip muffins. You don't bake the muffin and then push the blueberries or the chocolate chips in after the muffin is ready. You have to bake them in from day one. And you can think of accessibility that way as well. What we need to do is we need to make sure that every ingredient is part of that process. There are some myths, we'll call them, about accessibility. These are some things that as you become familiar with accessibility as a whole, you'll see that this isn't really the case. We've already talked about the fact that accessibility doesn't affect many people. 1 in 5, 63 million Americans, and that number is climbing. So this is definitely a myth. Accessibility can affect an awful lot of your users. Keep in mind as well that we're not talking about just persons that are using your site that have disabilities. The enhancements that you make for accessibility make the user experience for everyone visiting your site. Okay. Again, everyone has a role, not just the coding experts, not just the developers, not just the accessibility professionals can implement these fixes. There are steps that can be taken along the way by every member of the team, whether it's leadership and showing that awareness and dedication to a program, or even folks that are responsible for content at a fairly low number of pages or whatever the case may be. There's steps that all of us can take to implement small changes that in the big picture make a difference. Another myth is you don't have to worry about accessibility until you get a request or a complaint. That's not the case. Again, we're changing your culture. You need to really make these adjustments starting now and working forward so that that becomes just a day-to-day part of the business that you're doing. So don't wait until you get that request for an accommodation or the complaint about a non-accessible element. Finally, our next, accessible design interferes with general design and layout. And we can show you that that's not the case anymore. Maybe in the early days of accessible design, as some of these newer features and additional demands were being put on the internet, but that's not the case anymore with JavaScript, with CSS, mobile and responsive design. The elements are all there to make completely usable interfaces for every device and for every user that's coming out there. And finally, you're not required to fix it because it's too expensive. Well, can we do a text-only site, things like that? No, there is no escaping this. There's no safe harbor anymore, and thousands of companies will attest to that in the last number of years. So what we want to do now is we want to help educate you, make you aware of what this can be and what it can consist of, and then help you get that plan in place so that you're successfully moving forward and accessibility doesn't have to become a major focus. Okay, so now we're going to take another minute or two and talk about a little bit more of the rules just to kind of help clarify and give you an understanding, because you're going to hear these numbers, you're going to hear these terms popping up. So we're just going to give you kind of that 30,000-foot view of some of the rules that you may be interacting with. Okay, Amanda's already addressed 1557 of the Affordable Health Care Act, so I won't really talk about that at all. But what I am going to address is Section 508. I'm going to address the WCAG guidelines and some of those other areas, some of the other numbers. So first and foremost is Section 508. Now that is basically your baseline set of rules for accessibility in the United States. Now, to set the picture a little bit, Section 508 is essentially a procurement law for the federal government. But if you read into it a little bit, it also affects those who are federally funded. So in other words, if you're receiving funding from the government, whether it's research money or whatever the case may be, typically you are required to provide accessible web content, okay? This is not really the legal compliance piece of this. We'll talk about that in just a moment. But again, the baseline set of rules. So if you're familiar with what's required for Section 508, and as you see in a moment when we talk about ADA and when we talk about web content accessibility guidelines, you'll see that this is really kind of your library, your go-to library for understanding how and what needs to be accessible. Okay, next is ADA. ADA is, of course, the Americans with Disabilities Act from 1990, I guess. George H.W. Bush signed it into law, and it's really the first law that accounts for discrimination for persons with disabilities. Okay, as times change, we find that technology wasn't a consideration before the 90s. Well, it is a consideration now. We also look at our largest minority group on the planet, and that's persons with disabilities. And now we've put specific rules in place so that those folks that may have a disability are getting the same experience. We've seen it happen over and over again in the physical space, and now the movement is happening so that it's in the digital world as well. Within ADA, you may hear a couple numbers, Title II and Title III. Title II, again, refers back to more of the federal discrimination rules. Title III is public related. So if there becomes a compliance issue, a complaint that actually goes into the court system, typically it's going to be based on Title III of the ADA. That's the enforcement part. It's the public accommodation, and it affects pretty much any business. There's a little controversy yet going on. We expect probably in the near future the Supreme Court may even be involved and ruling on whether or not websites are considered public accommodation. Most of the district courts in the U.S. have said yes, it is, but there are still a few holdouts. And really what that does is it confuses the issue because it makes it difficult to enforce, across the country what that baseline standard should be and things like that. So there's more to come in that area, but it doesn't seem to be slowing down the juggernaut of lawsuits that are happening within the digital space. So keep that in mind, that whether you agree or don't agree that your website is a means of public accommodation, in most cases the court system has said yes, it is. Next, we'll go on to the WCAG or WCAG or WCAG, depending on how you want to pronounce the acronym, but it's the Web Content Accessibility Guidelines. They are a W3C standard developed within the W3C working groups that essentially set the rules or set the guidelines and techniques, etc., for the web. And that includes accessibility standards. Now, right now, the current version is, from the enforcement point of view, is 2.1. I'm sorry, 2.0, but earlier in the year, 2.1 became the base standard. Now, enforcement is not going to happen at that 2.1. It's a relatively updated set of the guidelines. Version 2.0 is our baseline. Now, this is important to remember because when we talked about Section 508 a couple of minutes ago, we didn't really define what those rules were. But within Section 508, the WCAG 2.0 guidelines, and we'll talk about levels in a moment, but levels A and AA, is the point of compliance that's expected. That is basically a global standard at this point. So it doesn't matter if you're operating in Canada, in Europe, in Japan. WCAG 2.0 A and AA is the expected global digital standard for accessibility compliance. Now, within those guidelines, we'll break them down a little bit further. There's A, AA, and AAA. Now, level A is the most severe, but it's also going to be probably the ones that can be fixed the easiest, okay? And they're going to affect the most people. It may be something like an empty heading. Essentially, you're putting up a road sign with no sign on top to tell people where to go, all right? So it's what can sometimes be simple content fixes, what may also become a little more code-based if we're talking about online forums, things like that. Example again, tabbing with a keyboard only if you can't use a mouse. That's going to fall under level A. Level AA, a little more situational. It's still going to affect the majority of your users, and that is, again, the compliance level that we're looking at. And color contrast is a perfect example of that. It's also quite a contentious issue usually. You have a design team, you have a marketing and branding team involved, you have a lot of folks that have a buy-in to your color scheme. But contrast can be problematic for a lot of users. And remember, too, we're talking about low vision users, we're talking about people with dyslexia, we're talking about color blindness. So color contrast plays a big part in that web design now, okay? Finally, level AAA, aspirational, I like to call them value adds. They're really very specific. Typically, you're not going to lose a user, but what you're going to do is improve the experience for all of your users. An example of that may be that audio media file. It may be a video where you have ASL sign language included. ASL is going to be a AAA level fix. Now that is going to be there and enhance it for everybody, but it's not, it's not going to be make or break. So keep that in mind that while AAA again is always ideal, it's sometimes not practical, and it can be deal breakers at times. So that's not typically a compliance issue that you have to focus on. All right, so now, Kevin, we get it. We see that there's a lot involved, but there's a lot of rules in place. As a company, Site Improve has the ability to help guide us. So how do we start this journey that you're talking about? How do we get going and start wandering down this accessibility trail? First and foremost, we want you to keep this in mind, because I think if there's one takeaway from my talking today, and that is that accessibility needs to be a process, not a project. Again, we don't bake in the blueberries after the cookie or after the muffin is already made. It's got to be part of that project. If you focus on accessibility as a project, what's going to happen is you're going to set yourself up for failure, because in 2 years, even though you spend all this time, money, effort, energy, blood, sweat, and tears making your site accessible, by not maintaining that accessibility, you're just going right back into the same position you were in when you're starting now. So set that baseline and know you're shifting that culture, and make sure that through the lifetime of a website or an app, that accessibility is a consideration. So there's some different points from an institutional or organizational level that we want to talk about. And first and foremost is, as you're getting this journey going, you need a formal accessibility policy for the organization, okay? Set the scope of what the expectations are, and then include some different things like what compliance level are we targeting, in this case, again, WCAG AA. And we want to make sure that we have identified that. We can identify a many number of things. It may be a timeline that you want to share with your audience. It may be some areas that you're expecting to see improvements on in the future, or areas that you know that you need to address. What you don't really want to include, though, are things like hard and fast specific dates for compliance. In 18 months, we will be AA compliant, no questions asked. Well, we have 26,000 pages. How are we going to do that? So you're setting yourself up for failure there either. What you want to do is you want to find milestones, put them into an action plan and a timeline that's feasible. Okay. One of the first things that you'll want to do as an organization once you've got this policy established is you're going to want to put together an accessibility statement that you can provide to the public. Now, this is very important because what it's doing is it's communicating what your plan is with accessibility, first and foremost. Okay, we understand accessibility is important to us as an organization. We are striving to maintain the most accessible site that we can. There may be some problem areas that we're working on, et cetera, et cetera. Here are the guidelines that we're shooting for. Some of the things that we talked about in that policy become part of that public accessibility statement. Now, Site Improve does have an accessibility statement generator that will kind of give you that framework and help you build. There's also a lot of good advice out in the W3C and the Web Accessibility Initiatives sections of the website to give you guidance on what that accessibility statement can include. Don't forget to get your legal counsel involved and invested in this project. And this is a perfect place is to build this accessibility statement with your legal counsel so that there's a clear understanding across the organization. And finally, the last thing to keep in mind is make sure that there's a point of contact on this accessibility statement. And this is important because you are providing that feedback mechanism so that anybody that does have an issue has a direct path to let you know that there's a problem, that they can't access this information, and you can work directly with them. Now, not to turn it back onto compliance, but if you do run into some of those legal issues, this is going to be a requirement very early on in the remediation process as well. So let's work on that right now, because what's going to happen is if you already have these feedback mechanisms in place, it takes a little bit of the credibility away from the complainant if they haven't tried these contact points first. Okay, I'm not saying that it's going to make things go away, but what I am saying is that you've already put a plan in place to work on accessibility. You're available and open to those suggestions, and that really, it makes you very proactive in this process. So again, here's some identifying things that we want to take care of and do. First, we want to understand how to start that program by identifying some realistic goals. Now, I gave the example of full compliance in 18 months a little while ago. That just isn't realistic. What we may want to do is we may want to look at in 6 to 8 months, we want to have our staff trained on accessibility awareness. In a year, we want to make sure that the content management system that we're working with, either internally or through an agency, understands accessibility, and they're helping us enforce accessibility with the work that they're doing. Okay, we want to look at those resources. Are we doing the work internally with our IT department, or are we just managing content and working with great companies like Genetric to help us put these successful sites together? We want to identify what the current legal and regulatory issues are. And in this case, we've already addressed the Section 508/ADA/WCAG. So we already know what we want to strive for. So it's fairly easy to do that, but keep an eye on those regulations. As technology changes, the regulations will probably change and stay updated as well. And finally, we want to identify our current risk levels, our current compliance areas that we're falling short. And this is where a tool like Site Improve is immensely valuable, because we're able to scan that entire site and find those issues, at a high level, all the way down to individual issues on a page. So you can really determine what those risk levels are and where you're at within that journey. Some other considerations within those realistic goals. Again, think about that timeline. This is a marathon, not a sprint. We are not doing a one-time quick fix and moving on. We are addressing this as a major part of our development process. Within that, we have action plans. Now, this really, when we think about an action plan, that really becomes more of a remediation plan for what your current situation is. But that action plan is very helpful moving forward to set those goals so that you can see that progress. Those milestones are going to fall into place, whether it's training, whether it's training for accessible documents, whether it's a remediation program. Find what those milestones may be within your current program, and then and then work off of that. And don't forget your budgetary considerations. You know, sometimes it's easy to get you know, the funding right up front for 2 or 3 years, but again, this is a cultural shift, so the budget is going to have to be there moving forward, so it needs to be the consideration. Another aspect of that is it organization wide? Is it handled at a department level? Is there a chargeback model in place for the work that's being done? I mean, all of those different scenarios and all those different questions will come up when it comes to budget. We all want an accessible site. None of us want to pay for it, essentially. So keep that in mind as you're setting those milestones, as you're moving forward on that timeline. So we talk about staff training, but let's think not just about the staff that are working directly on the site, but let's think about our entire organization and that cultural shift that I keep mentioning. Okay, so there's got to be an awareness, whether it's at the leadership level where the funding maybe is coming from, or the legal compliance has input, or if it's the technical training, you know, whether it's co-design, procurement, or whatever the case may be. We want to make sure that everyone that has a piece of the digital property under ownership is aware. When we talk about role-based training, which Site Improve focuses on a lot, we're talking about leadership. We're talking about designers, marketers, that procurement staff, and we can provide training on all those different roles to make sure that there's an understanding of what's going on within that aspect of accessibility training. So when we're identifying those risk levels, we're talking about you know, working off of that internal policy that we've already put together now. That was the point that we talked about a moment or two ago. Within that, maybe federal or provincial or state regulations. Current issues on existing properties. In other words, what is that baseline? And then that timeline. So again, your legal team will probably be involved in this process as you are developing it and growing it. Next, there are a lot of stakeholders, and what we need to be able to do is address all of the issues that these different stakeholders are going to have, whether it's management, HR, marketing, IT, compliance, purchasing, whatever the case may be, including other community stakeholders like department chairs, you know, management, things like that, and even our external agencies. We need to have buy-in from everybody. Now the agency part, that's easy because we are working with a team of people that already understand how important this is, and they're going to be your biggest advocates in building those accessible sites. So what we're looking for is those champions. Now, when you approach some of these different groups, there are some different talking points that you may want to look at. First and foremost, again, with management is going to be that compliance or that regulatory piece. There's a business case that can be built, but that institutional policy that we talked about already really has to have teeth. It has to be enforceable. It's easy to generate a policy, but then never do anything with it. It's got to be something that can be acted upon, and this is where risk management comes into play. Okay. Also, you have to find cost-effective solutions and introduce those. You can use examples of how accessible technology improves productivity. We already talked about pushing the blueberries into the muffin. It's less expensive and easier to do when you build it right the first time. And another example that we see quite often is the support resources needed if individuals cannot access information themselves online. It may be a call center line. It may be you know, a chat bot on the website. It may be interactive forms that are being built versus printing something out and mailing it in. So there's a lot of dollar savings that you can utilize and show to get buy-in as well. So within these components, it's really key that we have not only a concrete plan and support and ongoing program, but the shared commitment across the entire industry that shared commitment is we want this to be as accessible and usable to all of our members as possible. Okay. And finally, within that shared commitment, we've got that buy-in at every level. We have, next slide, we have awareness education. And again, we're talking about from leadership on down, everybody in the organization knows that accessibility is important to the industry. Okay, so you have those policies and those budgetary considerations built out. So that's kind of a general overview. We can go into a lot of depth in each one of these bullet points, and we're happy to talk more. But at this point, I'm going to turn it back to Amanda, and we'll be ready to answer any questions that you may have that came up.
All right, so Kevin just told you how to get started on the business end of things. Creating policies and getting others on board usually takes quite a while, but the good news is that you can get started making changes to your website while those other things are happening. So the first place to start is to assess where you're at today. Start by using an automated crawler tool like Site Improve to check your site for issues, but also know that that crawler tool alone is not enough. You'll need to also do some manual inspection. Now that's because these crawler tools can tell you if things exist or not, but they cannot tell you if what's there is meaningful. So for example, WCAG Guideline 1.1 is all about providing text alternatives for non-text content. So this refers to images, some forms of CAPTCHA, audio and video files, and that's just to name a few. So people who have low or no vision typically use an assistive technology called a screen reader. Now the screen reader reads the content out loud on a page. And when it comes across an image, it's looking for some HTML markup that we refer to as alternative text or alt text. And this alt text must describe the image. And this description is what a blind person will hear. So now, this is a healthcare system's mission page, and on the page are the words "actions speak louder than words," followed by an image of a girl, arms stretched out in front of her with her hands forming a heart. Below the image are several paragraphs of text. So I ran the Site Improve tool on this page, and you can see in the left-hand column that Site Improve flagged this image, asking if it should be marked as decorative. But if we inspect the code, you can see that this image does not have alt text. Now, because there isn't anything inside that alt attribute, Site Improve knows to flag the image for review. But in this example, this image was intentionally put on the page to invoke some kind of feeling or send some kind of visual message. So therefore, this is an example of an image that must have alt text. It's not purely there for decoration. Now let's pretend that I am the author of this site and I decide to add something into the alt attribute. And I'm just adding for this example, I'm just editing the code in my console, but if I was really the editor of the site, I would be doing this on the admin side. So for the example, I added the word girl into the alt attribute, and then I refreshed my Site Improve browser extension. And you can see that the number of images that Site Improve has flagged has gone from 3 down to 2. So this is good, right? Well, not exactly. The word girl is not enough to adequately describe this image, so we're still not making this page accessible. So this is why a tool alone is not enough. You need to do some manual inspection as well. And here's a list of some of the common accessibility issues that we see on websites. These are some of the things that you'll want to account for during your assessment. Things like contrast ratios, missing alt text, empty links, missing labels, empty buttons, and missing or inaccurate closed captioning, audio descriptions, and transcripts on videos and audio content. So once you have a big picture idea of all the issues on your site, you need to make a really hard decision. Do you remediate what you currently have, or do you blow up and start fresh? So if your site is fairly new, remediating might be the best choice. However, if it's been a few years since your last redesign, starting over is probably the most cost-efficient way to go. But if you do choose to remediate, you're going to need a way to prioritize your findings from the assessment. And now there's multiple strategies around this step, and I'm going to touch on 2. The first strategy is ranking the items by severity. This past May at the Access U conference, Mike Moore, the accessibility supervisor for Texas Health and Human Services Commission, shared an accessibility severity scale, which I find really helpful. So looking at each item, you'll rank them on a scale of 1 to 4. one being the most critical things to fix for the least critical. So a 1 means that someone will be prevented from actually accessing critical information or functionality. 2 means that someone will be prevented from accessing critical information or functionality, but there is a known workaround. A 3 means that someone will be prevented from accessing non-critical information or functionality. And 4 means that it's only going to impact the ease of use, but not limit access to information. So by ranking the severity of each item, you can decide which things are most important to fix first. Another strategy of this is to use a cost versus value approach. So on a sheet of paper, you'll create a scatter chart. Across the bottom will be value to end users from low to high, and vertically will be the cost to implement or fix the issue from low to high. Now divide your chart into 4 quadrants. The bottom left will be low cost, low value. Bottom right, low cost, high value. Top left, high cost, low value. And top right, high cost, high value. Then evaluate each issue and figure out where it falls on this chart. Now, depending on your organization's goals, you may decide that the low cost, high value issues are the best place to start, or you may decide that high value, high cost is the best place to start. Either way, this helps you prioritize the work that needs to be completed. Now, once you have a list of your priorities, you can actually dive in and start fixing the issues. And now this is the really time-consuming part where you're going to need to invest your resources. So if you have the knowledge and resources, that's great. If you don't have them, please get them. Hire the right people, contract with the right vendors, get training, and make sure that everyone on your team is accountable. Accessibility is not the responsibility of just one person. So anyone who's going to be touching your website needs to have at least a basic understanding of accessibility best practices. The next is quality assurance. So you want to make sure that you go through and test all of your fixes, and if possible, test on screen readers, test on multiple devices, but not everyone has that luxury. So at the very least, have another coworker look over your work. And once everything is ready and looks good, you're ready to release. So hopefully this is the easiest and most rewarding part of the process, but you are far from finished. Accessibility is not a one-time project. Just like you're always adding to your website and working to improve usability, accessibility is the same way. So you just need to figure out a way to bake that accessibility into your everyday process. So you have a challenging road ahead of you. Convincing people in your organization that accessibility matters and that it's everyone's responsibility will be hard work. There are going to be times when you feel like you're a broken record and you want to give up, but just remember that you are making a huge difference in the quality of life for someone. Now with that, I'm going to hand the presentation back to Kevin to go over some final thoughts and action items.
Okay, just a couple things that we are going to address for those quick wins. Culturally, these are the steps that we've already talked about, but we want to identify those champions. We want to find folks within the organization that really embrace this accessibility shift and do what they can to spread the word. It's really it needs to happen on so many levels. It's best when it can happen from leadership and flow downhill using gravity. That just makes it so much better. So find somebody that sits on a leadership council on the board and get them involved as a champion, and it should really help you get the resources that you need. Second, think about establishing an accessibility committee. I came from higher education, and the campus that I was on, we actually had a barrier-free learning committee where once a month we sat down and addressed accessibility issues, whether they were physical or digital. We had representatives all the way across the campus, including physical plant people, et cetera. And again, that policy had teeth, so we were able to actually act on different things. So keep those things in mind as you're building that culture. You want some quick wins on the website itself. Amanda's already talked at length about adding alt text. Now, folks that use assistive technology, do they even want images on the site? Of course they do. They want the same experience. Every image communicates additional information. Make sure that those alts are communicating that same information. It sometimes is a lot of work, but it's work that you can handle at pretty much any level. Okay, make those videos accessible. We rely heavily on video content now. Make sure that you're providing those captions, those descriptions, those transcripts as needed. Okay. Remove excessive movement or animations. Now, this one may seem like kind of a strange one on this list, but keep in mind that if I am suffering from dyslexia, anytime there's motion on the screen and I'm trying to focus on understanding a word, it's going to mess with me. There's other people that have things like vestibular disorders, inner ear, balance issues. That motion can actually become an impediment and cause them to get physically ill. Okay, so keep in mind that things like that, although they add some flash to the page, they're really not needed to communicate your message in most cases. If you need to have that animation or that movement, like a carousel, for example, make sure that there's a mechanism in place to start and stop it. So those are some quick wins. Those are some areas to consider as you're getting started.
All right. Thank you, Kevin. Thank you, Amanda. We've got time for a couple questions. We've got one here, a couple here. But if you had something and wanted to ask our accessibility experts here while we have them in the next few minutes, go ahead and type that into the GoToWebinar platform. But we'll jump right in here. Our first question, someone is wondering about the closed caption functionality from YouTube and wondering if that works for screen readers if the video is embedded on your site. Amanda, Kevin, not sure which of you wants to take that one.
Yeah, I'll take that one. So I am almost positive, like 99% positive, that it does in fact work on your site. And if you are using a mobile device, usually when those are embedded on your site, what happens is when you click to play the video, it actually opens up in YouTube. And so it does appear to be accessible from both a desktop and a mobile device. So you can tab to all of the features and get to the closed captioning for that YouTube video. I will say that YouTube, however, does not have the best closed captioning support. So while they are a wonderful tool and can kind of get you started on the closed captioning, you really need to make sure that you're going back in and assessing what the closed captioning actually says, because there's usually errors and mistakes. So you'll want to make sure you go in and correct those so that it actually does match up with what your video is saying.